Professor Pelosi, thank you so much for stopping by. Just first of all, could you tell us what type of publications you've selected from?
I tried to select a publication mainly focused on respiratory management of critically ill patients and moving from intubation to personalized mechanical ventilation, weaning phase, and the role of non-invasive respiratory support.
Well, let's start with Dr. Vincenzo Rossetto's study on peri-intubation events in critically ill patients. Can you tell us a bit more about this?
Yes, this was a multinational worldwide study looking at the intubation practices and adverse event in critically ill patients. And we found that cardiovascular instability was more frequent than we expected, as well as hypoxia. So the message of the study is to take care of this risky procedure in these patients, especially outside the ICU.
So next we have mechanical power in ventilated patients by Dr. Eduardo Costa. Why is this one of your top picks?
This is a very important study from clinical point of view that found that mechanical power, which is the energy delivered by the ventilator to the patient, was independently associated with outcome. And even more importantly, they found the difference between plateau pressure and PEEP was even more important than respiratory rate to determine mechanical power. And these data are recently confirmed also in different populations of non-RDS patients.
Moving on to another interesting study by Dr. Karen Burns, looking at the practice of invasive mechanical ventilation on critically ill patients. What were the main findings of the study?
This was also a multinational worldwide study. We found that the ventilator weaning and discontinuation practice in critically ill patients were different between different countries. And we also found that the weaning phase is very important to determine outcome of our patients. So the suggestion is to have local guidelines for weaning procedures in the intensive care.
And finally, a study by Professor Gavin Perkins comparing the effect of non-invasive respiratory strategies versus conventional oxygen therapy among patients with COVID-19 related acute hypersemic respiratory failure. What were the results of the clinical trial?
This is a very important clinical study, clearly showing that non-invasive CPAP led to a better outcome as compared to high-flow oxygen nasal therapy or standard therapy in this patient. But this study opened a new view in the role of non-invasive respiratory support in hypoxemic patients. So CPAP is probably the best method to support this patient before intubation.
Professor Pelosi, it's been fantastic to have you with us. Thank you.
Thank you very much.